All right, let's get started. Hi, everyone, and welcome to the University of New Mexico Law and Mental Health Didactic Series. This series is hosted by the University of New Mexico Department of Psychiatry and Behavioral Sciences and the New Mexico Behavioral Health Services Division. We're so glad to have you all here to join us today, as usual. And you might be able to tell I'm not Julie Brovko. My name is Emma Hamilton, and I am a current postdoctoral fellow in forensic psychology at the University of New Mexico. Don't forget that next week for LMH, we have Dr. Jeffrey Swanson, who will be presenting Reconsidering Outpatient Commitment, Threading the Needle Between Coercion and Care. For our talk today, please ask questions in the Q&A, not the chat box, anytime that you feel comfortable, but just know we won't get to them until the end. Also, we always try our best to get to as many of your questions as possible, but please forgive us if we can't get to yours before the time is up. For those of you who want CEs but are on a tight schedule, you do have to stay for the full hour, but you don't have to stay any longer than that, even if we are sort of answering questions or going over a bit. I'll try to let you know when the hour is passed, but we'll likely stay on longer, as I said, to address questions. For those who are wanting CME credits, you can access the sign-in sheet in the chat now or shortly. And then for APA CEs, the link will be posted when there's about 5 minutes left of the presentation. You have to save your certificate after you complete the survey. We don't keep any copies. And again, we've been having some issues with a lot of people trying to access the survey at once. So if you can't get through, just wait a little bit and it should be fine. The recording link and PowerPoint for today's presentation will be sent in a week. And now I would like to introduce Dr. Heath Hodges, our speaker for today. Dr. Hodges earned his master's degree in psychology from Drexel University and later attended the University of Nebraska-Lincoln, where he earned his Master of Legal Studies and later his Ph.D. in clinical psychology. He completed his internship at the U.S. Medical Center for Federal Prisoners in Springfield, Missouri, and received his postdoctoral training in forensic psychology at the University of Massachusetts Medical School. In 2021, he was board certified in forensic psychology by the American Board of Professional Psychology. Dr. Hodges has also previously served as co-director of the Forensic Psychology Fellowship at Bridgewater State Hospital in Massachusetts, and he now serves as the interim training director of the Forensic Fellowship at the University of New Mexico. He's located in Albuquerque, New Mexico, where he primarily works in the private sector through his business, Best Forensic Practice, and he specializes in criminal adult evaluations, addressing issues of adjudicative competency, criminal responsibility, risk assessment, and sentencing. He has also published in areas of violence risk assessment, threat assessment, firearm violence, and psychopathy, and given dozens of professional presentations on the topics of malingering, forensic report writing, expert testimony, and forensic assessment supervision. Dr. Hodges, thanks so much for presenting today. I think it's really fitting that I, one of your real life supervisees, gets to introduce you today. So I'm honored to welcome you, and we're so grateful to have you, and I'm going to turn it over to you now.
Great. Thanks, Emma, for the intro. And full disclaimer, the irony is not lost on me that a trainee introduced me for a talk on supervision, and I promise her evaluated performance is not in any way influenced by the intro she just gave. So I'll get into some housekeeping stuff here real quick. If I can get this, there we go. I have no financial relationship or commercial interest related to this talk, maybe someday. And even though I'm faculty at UNM, none of the views that I'm going to express today reflect those of the university. So when thinking about the subject of this talk, I think that this didactic series has a lot of great topics that have been covered. Some of them are more fringe than others. And I think that the subject of supervision and forensic mental health assessment is something that most, if not all of us, can relate to, either as trainees or supervisors. But I don't think it gets a lot of attention. So my hope today is to put a spotlight on something that really needs it. And I have a few goals that I'm going to try to accomplish as part of this talk. First I'm going to give a bit of a pitch for why I think supervision specific to forensic work is important and unique and should really start to be conceptualized, I think, as a competency in and of itself, much the same way that we think of test proficiency or report writing as a competency in forensic work. I'm going to review a little bit of the two models that I know of that are specific to supervision and forensic assessment, and summarize what evidence we do have about what's being done, what works, what we don't like, and then offer some recommendations kind of moving forward. Perhaps the best place to start is what is supervision? And so I think there's a lot of definitions out there. I'm kind of borrowing one, and perhaps it's applicable to forensic work and could be tweaked, I think, in some ways, but a few sort of major points are it's a distinct and deliberate professional activity. It's not something that should occur casually and parallel to other things. There's multiple methods for how to do it, depending on what the sort of competency is and where the trainee is at. It should be, I think, a collaborative process. So if you're a supervisor who is saying to yourself, they're my trainee, they do what I say, I would challenge you to kind of step back and rethink that. This should be a collaborative effort. They're a player in the game, and we're in some ways building a relationship with a colleague in the making. And the agenda of supervision is not purely professional in the sense that we're encouraging self-efficacy. It's just as important to teach them what to do, as well as to instill faith in their ability to do it. And related to that is promoting this idea of competency and getting them where they need to be. And of course, we should always be doing this in an ethical way, making sure that that relationship is appropriate while being collegial and supportive at the same time. So kind of just first recognizing that the field, at least of clinical psychology, certainly recognizes the importance of supervision. This has been established for a long time. And so there's commentary that has identified it explicitly as its own sort of competency. It's not simply a mechanism for transferring knowledge. It's something that in and of itself requires finesse and structure and skill. You see this also reflected in training. I know, at least in my doctoral program, I had to do an entire course in supervision. And there were many opportunities for me to engage in supervision of colleagues who were not as advanced as myself. And you see this reflected in sort of organizational guidelines, specifically about what supervision should be and how we should approach it. There are as many models of clinical supervision as there are supervisors. And so the clinical field has really got its shit together in some ways, I would say, and have developed a process for this. As it relates to forensic work, I don't think as much. Now, there's some recognition of the importance of supervision very generally. So the specialty guidelines, for instance, address supervision as it pertains to maintaining or acquiring a new competency. The American Board of Forensic Psychology in their guidelines for getting the early career waiver for postdocs discusses the importance, for instance, of having an evaluation form for evaluating supervision. They've also got a document that talks about core competencies in forensic psychology, and it identifies supervision as what they call a foundational competency. And they even make a few comments like it should be based in a theory of what supervision needs to accomplish, and it needs to have behavioral anchors so that you can sort of track progress over time. APLS, although they have a website for careers and training, they have resources for teaching, but there's nothing on there about supervision. While teaching may be a part of supervision, I would argue that they're not really the same thing. So stepping back from more organizational sort of recognition of supervision in forensics, we can look at training models that have been written by scholars and prominent figures in the field of forensic psych. And there are plenty of training models out there. However, when you start to really comb through the details, there's little to no mention about supervision. And by and large, when supervision is mentioned, it's just mentioned. There's not a lot of discussion about the process, about the content, about style, about techniques. I would say Packer and Grisso did a chapter about a decade ago where they really discussed the importance of supervision and specified why supervision can be helpful for establishing rapport, for identifying the process of the evaluation. But that only really kind of gets at a piece of what supervision, I think, needs to be for forensic work. Stepping back even from sort of formal writings and guidelines, ask ourselves, is supervision important? Why is it important for forensic work? And I would argue that there's a few reasons, and these are some that I've identified or have been identified by others. First, it's a way of orienting the trainee to how to appropriately behave and conduct forensic work. And this is a big thing in our field in particular. And sort of related to that is you're communicating professional norms. So there's what's ethical, there's what's unethical, and then there's what's conventional and not conventional. These are the things we do and don't do, and these are the things that, you know, maybe we haven't figured out just yet. And so there's this acclimation to what forensic work is. There's definitely a teaching component. Teaching facilitates the acquisition of knowledge. And so it's not enough to just read a case. Sometimes you need somebody to sit down with you and help you make sense of mental health case law and know how to digest that, how to make sure that your report is not overly inclusive and that it addresses the relevant information for the referral question. Practical skills. And so, you know, there's the didactic stuff like, what do you know about risk assessment? But then there's also how do you conduct a risk assessment? And that's very much where supervision comes in and sort of helps you establish those practical skills that you need to do this work independently. Obviously, sort of bigger picture wise, supervision is there to ensure the quality of future professionals in the field. And inversely, to sort of shield the field from people who are not yet at the point of doing this work competently. And overall, it's a mechanism, right, for enhancing, monitoring, and evaluating the progress of a trainee as they go. So I don't think it's a hard sell to say that supervision matters. Anecdotally, I think supervision is a lot like teachers. You know, it's the best and the worst of them that make an impact. And I'm sure most of us can probably think of supervisors we've had that were inspiring and supportive, and I hope I can be that supervisor someday. And then the nightmare supervisors that made the process challenging, maybe questioned our wanting to do this work or questioning our, insight about whether or not we are good at this. And so like from a very sort of emotional, intuitive perspective, of course it matters. These are the people sometimes that can change us in fundamental ways based on the professionals that we become. Kudos to anybody who recognizes all the people here, by the way. So experientially, we know supervision is important, and we know it a little bit, at least empirically. So did a survey a few years ago with some colleagues and surveyed trainees in internship and postdoc programs, as well as supervisors affiliated with those training programs. And uniformly across the board, supervision is conceptualized by both trainees and supervisors as something that matters in the process of becoming a good professional in this field. In the past decade, I would say, there's been increased discussion about whether or not forensic supervision is different than, say, clinical supervision, or is it just the same animal in a different context? We're identifying that forensic work obviously entails unique skills and competencies. And because of that, it might require unique approaches in terms of supervision. There are unique ethical quandaries, which supervision is definitely helpful for navigating. As I mentioned before, it's increasingly becoming recognized by organizations as well. There's still a lot of work to do. To my knowledge, we only have 2 models specific to forensic assessment supervision. There's commentary out there about supervision and forensic practice, but forensic practice is very, very broad. I'm referring very specifically to forensic mental health assessment and the role of supervision in developing that skill so that, as part of becoming a forensic evaluator. And I would argue, despite it being mentioned as important generally, or there being some guidance out there, that it's not, at least at this point in our field, identified as a competency in and of itself. And I would argue that maybe we should rethink that. So the title of my talk is Rethinking Our Approach to Supervision. So what are we rethinking? Well, I think the things we have to sort of question are assumptions we might be making about supervision, whether in the course of receiving it or applying it. Is there an assumption that clinical and forensic supervision are the same, that really you're just applying it in a different context? There's an assumption that we're approaching or that we're supervising stuff that we should be, that we're addressing what is relevant and we're not missing anything. We're not emphasizing something that ultimately maybe shouldn't matter. We're assuming that the techniques that we're using are appropriate for the particular kinds of skills that we're trying to provide our trainee with. There's a number of assumptions, I think, about the supervisory relationship, and those could be variable. Maybe the assumption is that it doesn't matter. You know, it's a very touchy-feely concept. You bond with your trainee. Maybe that doesn't matter in forensic work because we're very cold and professional. Or maybe there's an assumption that it does matter and we got this. We're doing it just fine. We don't really know. And first and foremost, I think arguably the most important aspect of this is we're assuming that supervision is working. We're assuming that we're doing it in the best way that we can and that it's making our trainees as good as they need to be. And that there's maybe no room for improvement. But there's not a lot of data, I think, to support these assumptions. And I don't know that there's a lot of introspection about it either. How often are we having these talks explicitly, even within training programs? How unique is this? Is this working? What can we do better? So, is forensics different? So clearly there's overlap, right? In the types of skills that you supervise in clinical work versus the types of skills that you need to supervise in forensic work. Obviously, there's a lot of overlap in the ethical principles that both fields have to adhere to. Clinical interviewing is part and parcel of both. Being able to conduct a differential diagnosis is often a piece of both. You don't always have to address a diagnosis in forensic work, but you often do. And you certainly have to do the piece of identifying potential sort of mental health issues that may impact the psycholegal issue. And report writing is part of both fields. Now, what you should be thinking right now is, yeah, but I can think of exceptions to all of these in forensic work. And damn right, you should, because it's not completely redundant, right? And this is to say nothing of unique sort of qualities that forensic assessment supervision may require. And I'm going to kind of start by, referencing one model of clinical supervision that I think is germane to forensic work. There's a lot of different models out there. One that I think applies is competency-based supervision, as opposed to, say, rapport building or culturally based. And that is basically what you do is you identify what you want your trainee to be able to do, and then you work backwards from that and say, how do we get them there? So if you want your trainee to be good at selecting, administering, interpreting psychological tests, then you identify where they're at, and you're like, okay, we start by education and then observation, and then they implement it, and then we review their write-up. And so this is a good, I think, analog for forensic work. The question becomes, are the duties in forensic work divergent enough from the duties, the competencies, so to speak, in clinical work? And I think it's a bit a priori, but I think we have a lot of different reasons for thinking that the competencies are unique in the two different disciplines. These are just a few examples. Some of them I generated, some of them have been generated by Demir and Holden in a chapter they did. But yeah, there's plenty of differences, and the competencies that a forensic trainee needs to acquire that a supervisor helps them get. Kirk Halburn has identified a lot of the differences just in the principles of forensic mental health assessment work. What is our role? Who's the client? The importance of impartiality, assessing for response style, All of those things present unique challenges for a supervisor that may not be as salient in clinical supervision. There's a lot of kind of retro engineering and unlearning of clinical habits, the use of psychojargon, for example, that a supervisor has to sort of usher them through. Forensic interviewing is not completely redundant. There are things we do and don't emphasize in one or the other. There's unique countertransference and bias, allegiance effects. The people that we evaluate may offend our value system. And how do we check that? How do we make sure the person in the room that we're evaluating who we very much dislike is not distorting our ability to do an impartial evaluation? Testing considerations, I could go on and on about that. There are disorders that we have to consider and navigate in forensic work that just aren't as common in clinical work. Delusional disorder, the issue malingering, psychopathy. These are going to require a bit of extra lifting or finesse. It's an interdisciplinary field. So obviously, getting your trainee up to par on what is a correctional system like? How does the legal system see this? Attention to response style is unique. There are a lot of unique qualities to report writing in forensic work that are not there in clinical work or have to be reworked. Arguably, we put more of an emphasis on safety because of the settings that we sometimes work in. The stressors and pressures of forensic work, I think, are very unique. I mean, sometimes you're in a high profile, highly publicized case, for example. Sometimes you work for agencies or institutions that have political agendas. We're not getting competency evals done fast enough. Why are so many people being found incompetent? How do we navigate those pressures? How do we respond appropriately to pressures that our clinical training may not really tap into? And of course, testimony is its own animal, right? I don't think there's an analog in clinical work for testimony. And so supervision is really going to be key to addressing these unique sort of competencies that we're asking our trainees to develop. Second assumption, are we addressing what we think is relevant? I think this is a two-part issue. The first is, well, what do we think is relevant? And then the second aspect of that is, well, is that what we're doing? Is that what we're addressing? So in terms of what we think is relevant, I'd like to sort of summarize at least two models of forensic specific supervision that I'm aware of. The first one is sort of a pyramid. It's a hierarchy in terms of supervision is very much like scaffolding. And so at the base, every trainee who comes in before doing forensic work should first and foremost be a competent clinician, be able to do all of those basic things. They should be able to do a clinical interview, differential diagnosis, psychometric sort of understanding and testing knowledge and administrative abilities, right? And before we get into anything too heavy lifting, the first thing you have to do is orient the trainee. There are values in forensic work that are unique and sometimes a departure from clinical work. What are unique sort of forensic ethical dilemmas and issues? What are the differences between clinical practice and forensic assessment? By forensic acculturation, that's referring to, all right, we as clinicians have a way of doing things. How are we perceived by the correctional system? How do we navigate that system? We're speaking to legal professionals. How do they conceptualize these issues, and how do we respond to those appropriately, and how do we resolve those potential issues? This is very much just kind of calibrating the way that they perceive practice. And then you kind of get into some of the heavier lifting stuff. After they sort of establish values, then it's about knowledge. What do they know? Do they know what they need to know to do forensic work well? A lot of this is going to be familiarity with mental health case law, which prior to forensic training, they maybe have had no exposure to. Unique cultural challenges, not just with the culture of the examinees, but the culture of those systems as well. And then sort of forensic empirical based information. So how much do they know about risk assessment? How much do they know about the content that should be in a competency evaluation? How much do they know about allegiance bias? A lot of this is going to be more didactic in reading. And sort of the next level of that is where you take that and then you apply it in practice. So it's one thing to discuss ethics and forensics. It's another thing to read the specialty guidelines. It's another thing altogether to be put in a situation with an examinee and have to make an ethical decision, to write a report and have to make decisions about what is relevant or what's prejudicial, which tests are appropriate. Sometimes we have to modify our thinking of testing because it's used in a different way or maybe completely inapplicable to forensic context. And then starting to think about communication of results. And the idea with this sort of model is not that you don't address the higher tier things until you've done those things. The understanding is oftentimes all of these things are addressed in supervision concurrently. What the model is sort of staggering is mastery. So you should master the values and the foundational knowledge before you really start to focus on mastering the higher level things, because they are sort of reliant on one another. The sort of peak of the pyramid is forensic conceptualization, making sure that they're doing that heavy lifting, that really sophisticated thinking. That should be the final thing that they're finessing. And sort of concurrent with this is this idea that supervision occurs on a continuum, that depending on the skill, but also early on in supervision, that it's more sort of instructional. You're giving them the answers, you're giving them the readings, you're teaching them. And then you're more of a mentor, and maybe it's more Socratic questioning. Well, what do you think? And then troubleshooting. And then eventually you're operating almost as a consultant. The way I think about supervision is it doesn't really ever stop. It just evolves and it becomes consultation. And the supervisors I've had in the past are now my colleagues and consultants now. And that's sort of what I hope happens with the people that I'm supervising now. So that model really focuses on content and process, but not techniques. Whereas Demir and Holden sort of address all of it and sort of propose a 6-element model. I'm going to go through each piece of this, and I'm going to get a little more specific as we go. So the first is modeling. You want your trainee to observe you doing forensic work, and then you talk about it. You walk your trainee through preparation of the case. It's discussion that happens beforehand, and you really, what kind of testing is good. What are we conceptualizing here? What do we need to do next? Live observation. So it's just as critical, it's important they observe you, but also that you observe them. But obviously the process of providing the trainee with feedback, and then supervision specifically about communication of results, such as report writing and testimony. They don't provide these images as part of their model, but I think maybe they should think about it moving forward. So modeling. They talk about this as important for 2 reasons. First, it's an opportunity for the trainee to observe somebody who's seasoned, possibly arguably an expert in something, in their craft, in their element. Observational learning can be very, very important, but it's also like a primer for discussion. Afterwards, what did you like? What did you not like? What did you think about the way I asked this? And they kind of get to develop their own style. They're finding things about what you're doing that they like and dislike, and challenging their sort of development as a professional by seeing how somebody else does it. Now, it's going to require things of the supervisor. If we put ourselves in a vulnerable position to allow a trainee to observe us, we got to make sure that we're doing it objectively, that we have the humility and sort of openness to hear that feedback. Maybe there's something that they disagree with, or maybe there's something about our style that we need to modify. That's a good point. I didn't think about that. And I think it can be sort of a reciprocal process in some ways, that having a fresh set of eyes on your craft keeps you from becoming dormant. And I think that's important for everybody. Preparation, as I mentioned before, happens in the beginning and throughout, obviously. So they get an opportunity to see how you communicate with the referring parties, and in discussing those psycholegal concepts and communicating to people who are not psychologists. You're really discussing the process of the evaluation, everything from test selection to who to call, and which relevant information goes in the report. And what can we expect when we walk in the room with this guy? Do they have a history of assaulting? mental health professionals? Is this somebody who we have good cause to think might be malingering? How might we navigate that in the room? I think that this offers a lot of unique challenges if you're doing training in a private practice setting, because private practice offers so many other sort of opportunities for learning. So for instance, clarifying the referral question can be a fairly straightforward process if you work for a BOP site and you get a court order for competency. Maybe you'd like to know a little bit about the details of what inspired this sort of referral, but that's different than some attorney calling you and not really understanding what they want, you having to help them understand what would be an appropriate type of evaluation. That's very different than negotiating rates with a client or a retainer, or if somebody who wants an examination calls you without an attorney, how do you navigate that? Like, these are unique private practice opportunities for supervision that could also be incorporated. They identified, your observation, the trainee, as one of the most important functions of supervision. They're very clear to say we're not there to be a co-pilot. We're there to be an observer and to help sort of guide or finesse along the way. It's also a great opportunity to see things that are not always self-evident if you talk to them afterwards. How did it go? Everything from subtleties in their interactions, like I had a trainee once who tended to, they were, I think, evaluating like a sex offender, and their questions were very kind of sharp, and they would sometimes cut them off. And there wasn't a lot of time dedicated to rapport building. And afterwards it was like, did you dislike this person? And they're like, yeah, as I think about it, I did not like them. Like, that's fine, but I would never have known that potentially if they had, I had asked her afterwards, how did it go? But sometimes they do really cool things and really good things, like set the pen down and make eye contact when they're processing a trauma, just to make sure that they feel present in the room without blurring the line of being, a clinician, of course. Sometimes there's, biases and countertransference that come up that they may not have insight to, that you can see in the moment. And then you kind of bring it up like, hey, I saw this. What did you think of that? It's good to have a plan about how the supervisor may potentially interject questions. So, sometimes you can be like, how would you, if I have questions, how would you like to do that? Maybe, do you want to pause at certain points in the eval and kind of look at me and say, Dr. Hodges, do you have anything you'd like to ask? If you interject, make sure that you're sort of deferential. Oh, doctor, do you mind if I ask a question? And then you ask one, so that you're not undermining the trainee. Feedback obviously is an important part of this. And so they suggest that feedback, you don't want to just go in guns blazing, like, this is what you did wrong and great and horrible. You want to make it a little more open-ended and put it on them. So how do you think that went? What do you think you did well? What do you think that, you'd like to sharpen up or that you wish you had asked? And then that's an opportunity for you to chime, yeah, I don't think it was that bad. Or, yeah, that's a good point. Well, how might you have changed that? And it makes them an active participant in their own sort of training. And I think that's going to yield better results. I think it's very important to realize that feedback has to be balanced. Remember, we are charged with not just making them better professionals, but in some regards, tending to their sort of welfare as trainees, So I'm going to point out some things that I think you could do better, but that doesn't mean you're shitty at this kind of work. You're fine. These are skills, and we're just going to fix them. Okay. And, supervision should have good and bad. It should have constructive feedback if it's there. And you want to emphasize their strengths too, so that you don't discourage them or alienate them. I think it's important to pay attention to their affect. They may not tell you, but if they all of a sudden become like closed off or defensive, pay attention to that and address it. With testing, they have suggestions, for checking it, but really leaving the interpretation on them. It's an opportunity to them to develop those things. Conceptualization is going to be similar to clinical work, but you're really emphasizing that connection between the mental health or cognitive deficits and the psycholegal issue, and generating alternative hypotheses. I think that the supervisory relationship, your rapport with the trainee, is critical for this stage to make sure that feedback is a very organic and non-defensive process and helpful. writing. So with this, obviously, report writing is one of the sort of marquee skills in forensic assessment. And writing is different than clinical work in many ways, but there may be a need to sort of make sure that the data always guides what the person's writing, and sort of maybe explicit discussion about the distinction, for instance, between facts and inferences and opinions, and making sure that that manifests itself on the page, making it clear and readable, omitting psycho jargon. And I really love that they recommend this, which is that it's not good enough to just tell them what to do, but you explain why. And I think sometimes you don't want to dictate things. It's okay to make it a conversation. So something that I do in my supervision is I'll leave comments and track changes. But sometimes track changes are not the best medium for that. Sometimes I'll say, I do these little headlines like food for thought, how might this, appear prejudicial, or discussion point. Let's talk about your use of the word deny. And that's a conversation. Or you don't want to put test results in your report. Some people think that we have to be transparent and ethical. Let's talk about it. And so, sometimes you're just saying, it's okay if you do this. I just want to make sure that everything that you're doing is thoughtful and the alternative side of the argument. So having conversations about reasons, not putting everything in track changes, can be helpful for that. You don't want to come off as overly pedantic or critical because you have 125 track changes in your report. Some things are best left as a discussion. Testimony preparation, obviously important, can take several forms. I think mock trials are great. I love them. Seeing people testify, as many different people for as many different issues, I think is great. I think we all have truisms when it comes to testimony. I think Rick Demir is fond of saying, it's not about you. I think I say, be likable, be transparent, and be like Tom Hanks or Meryl Streep. Discuss whether testimony is likely. I think that feedback in and of itself can be its own form of testimony preparation. So for instance, I could challenge somebody's, a trainee's use of a test or a diagnostic conclusion by saying, well, why did you do this? But sometimes they like to say, so let's say you're on the stand and the prosecutor asks you, doctor, isn't it possible for somebody to be intellectually disabled and still competent? And then they would say yes. And you're like, so how did you possibly do this then? And you're deliberately antagonistic. You're deliberately undermining what they're saying. And it's an opportunity for them to give you a testimony-worthy answer. So if the trainee is like, I don't know, I felt like, and they're kind of struggling, be like, okay, that's right there. You need to polish this up. You need to finesse it, because that's what you have to do on the stand. And so you don't need a mock trial to do that. You can do it in supervision. So go back to the drawing board. We'll try it again next week. Let's see how that works. And then you're like, boom, you got it right there. That's the only thing you needed. Don't get lost in the weeds, so that it can be a dynamic sort of part of feedback itself. I have thoughts about whether or not YouTube clips can be used. I know there's a lot of discussion about the Johnny Depp, Amber Heard sort of trial and the various experts. And without being disparaging to those individuals, it's potentially a really cool opportunity to observe that and be like, so what do you think they did well? What do you think made them look not great? What about their practice and does not sound good? And so it's a great opportunity to sort of vicariously sort of experience testimony training in some capacity, I think. So the models are what we think we should be addressing, but what are we actually addressing? So did a study a few years ago and asked supervisors, what are you focusing on in supervision? And then Tom Grisso and I did a content analysis and identified at least 16 different domains that supervisors are focusing on in supervision. I'm not going to go through all of them, but the ones that were most commonly reported as being emphasized by supervisors, these are going to be internship and postdoc, are forensic ethics, and examinee rights be things like ensuring that the examinee in certain cases understands different features of the notification process, even if it's court ordered, trying to clarify that. legal expertise, understanding of the local sort of standards, whether it's statutes or case law or legal convention, frankly. Forensic interviewing, obviously forensic report writing is by and far the most emphasized content area by supervisors. And impartiality, ensuring that the trainee is not accidentally slipping into advocating for the individual and sort of falling back on those clinical roots, making sure that we're emphasizing professionalism instead of, empathy, things like that. Let's see, do I want to go over any others? No. And then we also asked trainees, well, what are supervisors doing? And the way that we sort of assessed this was we asked the trainees to identify who they perceived as their most effective and least effective supervisor. We deliberately did not ask them likable, because you can have a very effective supervisor that you do not like, especially in forensic work. And so we wanted to distinguish this. And in a way, it's not surprising, but what you're seeing are differences in what supervisors are emphasizing according to the trainees. So across the board, more effective supervisors are more likely to have as part of supervision discussions about ethics and forensic mental health assessment principles, ensuring that what is being done is supported by the science, and making sure that they're understanding their place and not exceeding the sort of bounds of what we're being asked to do. Least effective supervisors just don't seem to emphasize those things as much. I'm breaking this, those were values. I'm breaking this into values and skills and techniques, because supervision is not as binary or linear as good report writer. There's all of these other things, as we just saw both trainees and supervisors acknowledge that there's more to it than that. In terms of what skills are emphasized in supervision, similar results in that more effective supervisors are more likely to really emphasize the trainees' ability to implement cultural considerations and ethical decision-making. Test selection, whether it's the selection of sort of a standard test or a forensic specific test, and they're more likely to place an emphasis on testimony and testimony prep and things like that. Interestingly enough, both what you might call good and bad supervisors emphasize report writing. So this is the one sort of marquee sort of skill that all supervisors seem to be doing. But if we can consider this more dimensionally, we're seeing quite a bit of variability, at least from the perspective of trainees, and what supervisors are emphasizing beyond that, how they do it. And so more effective supervisors are more likely to provide instruction, to offer readings, to focus on problem solving and insight during supervision. They're more amenable to being observed and observing their trainees. And professional development is more emphasized in supervision with these individuals. So the supervisory relationship is sort of, I guess you could describe it as having sort of two facets. First is sort of there's a mutual understanding about the point of supervision. Like, this is what we need to work on. Not just you're going to be a good forensic psychologist, but like, okay, so, you mentioned that you want to gain more familiarity with tests that help us inform malingering. How do we get there? Do you feel like we've gotten there? Do you feel more proficient? As well as just rapport with the trainee. Do you feel like your supervisor has your back? Do you feel like they're gaslighting you? Do you feel like they're on the same page as you? Those are critical to clinical supervision. When you look at the research and the sort of clinical supervision lore, it's one of the strongest predictors of supervision being effective. How they define effective and outcomes in that context is client gets better, and decrease symptoms or improve quality of life. We don't necessarily have an analog for that in forensic work unless it's like report writing ability. But it's foundational in clinical supervision. And when you ask trainees and supervisors, they agree. Yeah, the relationship between the trainee and the supervisor does matter. It's not just about the technique. It's not just about the skill. It's about that bond. And funny enough, it seems that supervisors place more emphasis on it than trainees. I'm not going to go through this in too much detail. Basically, we ask trainees to sort of complete a measure of the supervisory relationship modified between most and least. And sort of they reported having more of a stronger alliance with their supervisor for supervisors that they thought were more effective. And that was reflective in the amount of time that the supervisor kind of placed in supervision, both in terms of how many meetings and how much time those meetings were. And not surprising, I guess, they were more satisfied with supervisors they perceived to be more effective. I want to talk a little bit about negative experiences that trainees have with supervisors. This is tricky to get to. This was sort of a multiple choice option where we generated a few options and asked how often were these issues in supervision, with the most common being mixed signals, but also this perception that they were being asked to do inappropriate sort of assessments, with testing and things like that. Being asked by their supervisor to change their recommendation, which frankly could be appropriate depending, but it's interesting that they perceived that as problematic as opposed to, yeah, they guided me to a conclusion that we both agreed on. I thought it was really interesting that when trainees think about negative supervision experiences, that the perception that the supervisor themselves is incompetent tends to be popular, as well as being asked to do unethical kind of things. Unclear what that would be, but it could be, well, we did ask about disclosure, and it wasn't so much that more effective supervisors disclosed less, it was more about what they disclosed that distinguished them, in the sense that it would be more personal or inappropriate. And then not getting credit for the stuff that they do is a common concern. There's so much more here that we don't understand. We don't know the prevalence of gaslighting. We don't know the prevalence of feeling like you're coerced into doing things by your supervisor. I'd love to explore this more so that we can fix it. Anecdotally, I know of so many people who have had these negative experiences, and it's just, how do we know and what do we do about it? And when asking supervisors what they actually look at to determine if the trainee is meeting their benchmarks, these are listed in order of frequency. So report quality is by and large the most popular outcome that's emphasized. So the supervisor's assessment of the trainee's report writing abilities. And then it just goes down from there in the sense that ethical decision making and interviewing are big. Report efficiency has to do with the quick turnaround, getting faster over time. Autonomy, expecting the trainee to be more independent over time. Responsiveness to feedback is a big one as too. However, the extent to which these things are actually being measured in supervision, who knows? And whether they're actually being monitored, or if all of them are being monitored, who knows? And then, just as importantly, whether or not by emphasizing these things or not emphasizing these things matters in terms of, well, the trainee we want to be this high caliber forensic professional, is it working? Are our trainees actually getting better? I want to emphasize a little bit about cultural considerations. I think that the term culture gets thrown around a lot, and it's important to unpackage this. Now, I think, on the face of it, more obviously, culture has to do with the examinee's culture and how their culture influences the referral question potentially, how their culture influences whether or not we can administer a test or interpret a test. Cultural misattribution, is it a delusional belief, or is it an extremist belief, or is it a sort of a culturally appropriate belief that's maybe being labeled as something else? But I think beyond that is the culture of the trainee and the supervisor, and not just in the room with the examinee, but between each other. And so this can impact the evaluation as well as the supervisory relationship, and that can create power differentials. So I think that, for example, now we have issues in the spotlight that really needed to be there before, like Me Too and Black Lives Matter. I recognize that I'm a white male in a position of power. And, you know, that matters. And it's something that might matter in particular to a trainee, depending on that kind of how those variables are changed. And so I'll have an explicit conversation at the beginning of supervision where I sort of acknowledge those things. And it's like, I hope that I'm never insensitive to these things, but if I am, I don't want you to have to also worry about if I'm going to be receptive to that. I'm telling you right now, I am. And if I can do better, I want you to tell me. And you just put it right out there. And you can incur, I think, a lot of respect, but also you establish right then and there that this is going to be a mutually respectful kind of dynamic. Supervision itself is culture. If the trainee has had really bad supervision experiences, I would want to know about those. I myself have had supervision experiences that have flavored my approach to supervision. And that may or may not be appropriate at certain times to offer a supervision to say, hey, you know, this is something I struggled with, and let's talk about that. And making sure that it doesn't negatively influence your approach to supervision or being supervised. Earlier, the better. You know, I think it's good to have explicit conversations about these things. Demir and Holden mentioned that in their chapter as well. You know, these are things you want to address the elephant in the room. You want to address things that, should they become issues, you've already said there's a dialogue here. Other recommendations that I couldn't really organize in any other way. Demir and Holden in their chapter have great recommendations for supervisors. Be qualified, be prepared, be flexible. Be true to your own style. If you're not warm and fuzzy, don't be warm and fuzzy. I am just somebody who incorporates humor into a lot of things. And so obviously I would always want to monitor the humor to make sure I don't offend somebody or say something that could be perceived as inappropriate, but also I don't want to be dry. Like I have to be humorous. It's just the way I do things. And I'm a funny guy. So it's important that I honor that. And Rick Demir mentioned this, don't try to make them you. So we're not looking to make a mini version of you. It's about making them the best version of themselves. So particularly at the end of sort of training for the postdocs here, at least, at the end, I'm like, you need to figure out your style. I'm going to dictate as little as possible. I'm going to challenge you, and then I'm going to ask you to go from there. Insight is another term I think we don't always unpackage. I think there are practical ways to be insightful as supervisors. And I think, you know, first and foremost, asking yourself, do you give a shit about supervision? I don't mean that facetiously. I mean, supervision is a lot like having kids. Some people, it's really what they want to do. It's super important to them. Other people are like, yeah, if it happens, cool. And other people are like, hell no, I'd rather just save my money and take 2 weeks to go to Hawaii every year. So if supervision is not something that is a sort of professional priority for you, then to make sure you don't get yourself into too much of it, or make sure that you're not getting burned out too much. If you've been doing this for a while, what's your history look like with your supervisors? Is there a thread or a trend? Oh, they keep telling me I'm a narcissist, or anything like that. That would be interesting. And then what are your relationships like with former trainees? Do the relationships just magically dissolve, like you never hear from them again later? Is there a reason for that might be attributable to your supervision style and an area for improvement? Reflect on yourself personally and professionally. You know, if people close to you tell you that you have a tendency of being passive aggressive, is that a macrocosm? Are you sometimes being passive aggressive in supervision? If you've been accused of being defensive, are you being defensive in supervision? Try to monitor your feelings in the moment with the trainee. Do you dislike the trainee? If so, unpackage that. And remember, you don't know it all. I mean, we're all figuring this out. We've mentioned the importance of the supervisory relationship, so don't just focus on the skills. Also focus on that bond between the two of you, making sure they feel heard, making sure that they feel comfortable discussing difficult topics with you as much as you can. I think getting feedback as a supervisor is key. How do we get that? It's tricky, right? Because there's already a power differential. They're in the midst of training. I mean, they don't want to risk fallout, right? First, I think it's helpful to have formalized feedback. You have a quarterly, for example, review form for supervisors. Kind of like what we expect of trainees. I try to go into the room with my own observations, like, and my own sort of recommendations, like, hey, I'm feeling like I could do this better as a supervisor, and here's what I'm thinking I could do to do that better. And then you give them an opportunity to be like, oh, I hadn't noticed that, or oh yeah, I mean, it has been frustrating at times. And so it can be more of a, you're not putting as much on them to come to the table with something that could be very difficult to bring to your attention. It reinforces the evaluative process within yourself and makes it more collaborative. Yes. A few points for trainees before I wrap up. Embrace supervision as an opportunity. Many of you may be going through supervision now. Some of you may be going through horrible supervision now. You can still learn something from it. Just remember that, find the silver lining. As a trainee, try to be as flexible and humble and insightful as you can, to try to suck as much of that wisdom out of the situation as you can. Be kind to yourself. Even if you make mistakes, some that you're ashamed of, I can tell you it doesn't stop after supervision. And just remind yourself, just because you make mistakes doesn't mean that you're a mistake. And that's part of the process. You have to recover to become better. And sometimes the hardest lessons are the most important ones. Tom Hanks talked about the rule of saying no. I think that particularly in the latter years of training, it's a great opportunity for you to develop an assertive voice and be like, these are my limits. These are the things I'm not comfortable with. How do I own that? How do I have those boundaries? And how do I communicate it in a way that doesn't alienate me from the supervisor? That being said, sometimes you don't have a choice. Sometimes your supervisor is just not good. Maybe they have a lot of personality traits that are pretty negative. You just got to keep your head down and get through it, and that's okay. Just reference the points earlier on this slide, and try to think about it constructively. Like, what am I learning from this person about the kind of supervisor that I don't want to be? How much of this is stuff that they're doing that can be fixed, and how much of it is activating something in me? And sort of related to that is always, I think we need to do better about thinking that we're not just learning a skill, we're also trying to learn how to convey that skill to the next generation. As an early career professional and early supervisor myself, it can be a bit of a shift to sort of acclimate yourself to, this is how I write a report, to this is how I try to help somebody be better at writing reports themselves. They're not redundant skills. And so the earlier you can be thinking about how would this influence my supervisory style in the future, I think the more ahead of the game you'll be. Oh, look at that. Beautiful time. All right, that's all I got.
All right, thank you so much, Dr. Hodges, for such a great practical presentation. And we do have some questions. So just so everyone knows, we are at the hour, so if you have to hop off, go ahead and do that. If you can stay, we do have some great questions. So the first question kind of has to do with gatekeeping and supervision. So how do you handle cases when it becomes clear that a trainee really isn't a good fit for forensic practice? And there is a follow-up question there. How early in training do you feel comfortable making that call?
Right. Well, yeah. And so gatekeeping is something that, Demir and Holden also emphasized is critical. I think that, well, first of all, I conceptualize gatekeeping as sort of the final alternative. I think it behooves us as supervisors to be very explicit as soon as we see a problem, that we document it, we try troubleshooting it, so that by the time, if we get to gatekeeping, we've sort of exhausted all options for remediation. I don't think it's a decision that can be made lightly. And I know it's not a conversation that can be had easily. And at the very least, you don't want it to seem like a conversation that is a complete and utter surprise to your trainee. If they've been completing an internship program and they're not hitting their benchmarks, they shouldn't be completely hoodwinked if by the fourth quarter you're like, I'm sorry, but we just don't feel like we can pass you. We don't feel like you've met these benchmarks, without being able to point to the 16 different instances prior to that where you tried to resolve these things and you tried a remediation plan and it just wasn't working. So I think it's very important to exhaust those options, to document those options, to communicate those concerns leading up to it, so that if you have to be in that position, it can happen as seamlessly as possible.
Great. Next question is, what information would you share with forensic supervisors who tend to consistently lean towards the hypercritical, non-supportive role, and whose interaction style leads the supervisee to guess they are unliked by the supervisor?
This is what advice would I give those supervisors as opposed to the trainees trying to talk to those supervisors?
Yeah, so I bet either would be helpful,
Right.
but yeah, so what information would you share with forensic supervisors who tend to be that way?
Well, I would say first and foremost, the clinical supervision research has indicated that early career supervisors tend to be more critical. And it's not because we come out of, training bigger assholes. I think it's because we come out and we have been putting all of our effort into trying to be better at this, that we haven't stopped to think about the process for translating that to less experienced professionals. And so I would say, keep that in your mind if you've, for instance, if you're new at this, that, okay, pull back kind of thing. I think that also, I think you kind of know in the moment to some extent, you feel like, if you're feeling frustration or chronic agitation with a training, I would say, look at that and be like, okay, maybe they're messing up a lot and that's agitating me, but am I dealing with this in the way that's most effective for them? Once you realize that negative affect is there, once you're realizing that trainee is kind of not hitting a lot of benchmarks, it could even be as quantifiable as they're not proceeding through the training program like they need to. Part of that evaluative sort of remediation process has to involve you, I think, and being sort of cognizant of that and being like, all right, what could I do better for this trainee to help them kind of get there? What percentage of my feedback is negative? What kind of affect am I perceiving in the individual? And just trying to calibrate that. And it could be a candid discussion. It could just be a private reflection. Like, I got to stop doing this. And then maybe just being overtly very explicit about your efforts to emphasize the good. And so if it's not your style to give compliments lightly, maybe kind of push that a little bit. And try to be like, okay, what are they doing well? I've had conversations where I had to give the trainee not great feedback. And at the end of it, it was so clear that this individual was despondent and feeling like hard on themselves, and had to be like, look, I know this is a tough conversation, but you can do this. You have a lot of really good attributes. I think it's great that, and then I went through all the things and the strengths that they had. Just to reinforce that just because they have challenges doesn't mean that they are powerless over those challenges. And empowering your trainee is just as important as the rest of it.
All right. Here's another question. My supervisees have a tendency to stay in touch and even come back in different capacities to work with me. Any recommendation on navigating the relationship between being a supervisor versus a supervisor kind of case consultant relationship, or maybe kind of as those relationships evolve?
Well, that's a good question. And not just in that scenario, but just in general, right? When the trainee sort of finishes. Instinctively, generally, I would say a gradual approach. And it depends. Depending on the relationship you had with them before, that may be a more seamless process. I would say to still be careful in the beginning, slow burn it. And because bear in mind, it's not as linear as trainee to employee, that dynamic can now evolve. They're in a different role. And so you don't really know how that role will impact the dynamic with you or other people in your department, for example. And so lying in wait, observing, continuing to be supportive, and not just, for example, like bombarding them with your frustrations too soon. If you would never disclose those things in the past, and keeping it, at least initially, more sort of nurturing and protective and professional, and then feeling that out as feels comfortable with the individual over time, or individuals over time, kind of generally what I would say.
Great. We also have a couple of comments just saying, thank you. This was a great presentation about the importance of supervision. It's a topic that doesn't get addressed enough. We have an individual who appreciated your response about gatekeeping. I agree. I feel like that is not addressed enough. It kind of is something people don't want to touch with a 10-foot pole. So yeah, great feedback there. We have a couple other questions. How would you suggest supervisees who fear retaliation approach supercritical supervisors?
Well, I'd love to give like a super polished answer, like have a conversation with them. And sometimes that's capable, but the premise of this question suggests that those bridges have already been crossed, or at least, they're behind them and they're dealing with, at that point, a very acerbic situation. It's tricky. I think the first thing to do is assess the landscape, the political landscape. As much as I hate to acknowledge this, they may not be in a position to do anything about it. If you have a supervisor who is at the top of the hierarchy and there is nobody to report them to or to discuss this with, you may not have much of an option. The best you may be able to do is modify your behavior to prevent the situation from becoming exacerbated, which may be sort of a very unpleasant experience. Now, this is assuming that those difficulties are sort of in a gray zone or not overtly problematic, such as like being sexually harassed by your supervisor. I think once you get to that point, you might need to start asking yourself some serious questions about, is this situation so toxic? I need to think about a constructive, practical, and safe way of getting out of the situation as soon as possible. And if you're starting to lean in that direction, you got to consult. And I don't mean with just colleagues. I mean, if you can consult with a former supervisor that you do have that relationship with, I think that can be so helpful. They can help you navigate that, because let's face it, we live in a very isolated, incestual field. Everybody knows somebody else, and you can't ignore that. And I think it's good to be thoughtful of it without it sort of enabling a power abuse, so to speak. And so those are some of the things, if you can work around it, if you've already tried talking to them, then you may have no other option but to get out of it, or to just say, I just got to get through these next 2 months. I'm going to hate life. I just get through it. And then this is how I constructively move on after this. Yeah, that's unfortunate.
One of the last questions here, what recommendations do you have for trainees of color when working with supervisors who are not culturally aware?
Well, obviously I can't personally relate to this, right, as the white male. And so that's such a good question, because if the supervisor is not putting it on the radar at the beginning of supervision, obviously I could see how that could be awkward or inviting certain things. You're not really sure what the ramifications of bringing that up with the supervisor are. I think that sometimes a way to kind of safely sort of touch on that initially is to have conversations about race and about those things. I remember I had a trainee who had a Black Lives Matter sticker on her laptop, and it was the laptop she used to conduct evaluations. And I remember asking her, I was like, so, what would you do if you were in an evaluation and the examinee commented what is that sticker? Or maybe they knew about it and maybe they weren't a fan of it, because that can be a polarizing thing. Like, how would you address that in the room with the person? How would you address that in your report if it became an issue? And she was like, oh my gosh, should I take the sticker off? And I was like, no, I'm not saying that. I'm just saying these are the things you have to kind of think through. But what it did was it created a context for discussing race, which creates in turn, I think, an easier segue to discuss race or ethnicity or culture with the supervisor themselves. And so, I think sort of indirectly that topic can be broached sort of in the context of an evaluation, and then maybe look for an opportunity or volunteer something about yourself in that moment and see how it's reciprocated. And so that could be a sort of a delicate, gradual way of sort of easing into it. Or if you have a supervisor who you really feel comfortable with, you're like, hey, so I was thinking about something, I saw this talk, whatever, something we've never discussed is this. And then you just kind of lay it out there and have some ideas in your head about why it matters, why you're bringing it up. And that could be a great sort of dialogue that starts without needing those sort of other opportunities to do it in.
All right, well, I think that is it for the questions for today. So thank you so much again, Dr. Hodges. This was a great presentation. And I do think there might be some issues with the link. Alex wrote in the chat box, but if you want to speak to it real quick, Alex.
Yeah, thank you. Everybody, the CE link seems to be having the same issue that we had a few weeks ago. I will be sending a new link to everybody that attended today later this afternoon. So just please keep an eye out for that. Thank you.
All right, well, thank you again, everyone, for attending, and we will see you next week.
Thanks, everyone.